Dig in a little deeper on the pandemic and the impact of that U.S. vaccine donation. Let's bring in emergency physician and ABC News medical contributor, Dr. DARIEN Sutton, for more on that. Dr. Sutton, thanks so much for being here. How significant do you think these 500 million doses will be to the global fight against COVID-19?
Well, good afternoon, Diane. It's significant, and it's an important step in the fight against this pandemic. As the president stated, we have to meet the moment, and right now it is our responsibility, given our access and privilege to these effective vaccines, to provide help where help is needed. But as I said, it's a step in the right direction. What was just stated earlier, the WHO has estimated that we'll need approximately 11 billion doses to get through this pandemic, and right now estimates have us at about 2.25 billion doses given around the world. So we have to continue to support this effort, and hopefully we'll get some cooperation and participation from our allies.
And we often talk about this as a gesture, like a charity gesture, something to do to help these other countries in need. But how do these kinds of moves affect us here in the U.S.?
Great question. So first and foremost, of course, we have a moral standard to prevent the loss of lives, especially since this vaccine is proving to be so effective. Secondly, we want to make sure that hospital infrastructures are not crumbling under the weight of COVID-19, as we know that leads to economic instability in this global economy. And then the most important point is that decreasing transmission decreases the risk of new variants and new mutations developing, which can threaten the effectiveness of our vaccines and safety here at home.
And I know the FDA has approved extended shelf life of the Johnson & Johnson vaccine now. So what does that mean? And how does that affect the push to get people vaccinated, both here in the U.S. and globally?
So this is great news. I want to remind everyone that thermoregulation and shelf life studies happen in real time. So it's not news to really hear this from Johnson & Johnson, and I expect to hear this from other vaccine producers as more time elapses and more studies are coming in and data is coming in regarding the stability of these vaccines at different temperatures. And of course, this means that we'll improve access to communities in need that may not have immediate access to pharmacies and these high levels of refrigeration and freezing temperatures required for vaccines.
Now, Republican Alabama State Senator Tommy Tuberville tweeted today saying that he got his COVID vaccine and that it is safe and effective and free. Alabama has one of the lowest vaccination rates in the country right now. So what more can be done to reach areas where there appears to be more hesitancy?
So this is a grand issue of trust, to be honest with you. Throughout this pandemic, there are many who are rightfully concerned and fearful, given the fact that there has been a foundation of fear with an environment of mixed messaging. And I think that opportunities like this need to continue to be taken by our leadership to make sure that people understand the effectiveness and safety of these vaccines, and to get messaging from people that they trust. And hopefully it stops people from looking at alternative information that is not based in science. I'm hopeful that if we continue to be transparent with this data and show the brilliance and effectiveness of these vaccines, that people will come around and get vaccinated.
The FDA Advisory Committee is also meeting to discuss giving kids the COVID vaccine, ages 5 and up now. So what will they be looking for, and what do you think parents need to know at this point?
Yes, so these are age de-escalation studies. What happens is that the Pfizer and other companies will go through the different age groups to test for the safety, first and foremost, of these vaccines, and then also something called immunogenicity, which is basically looking at the antibody development after the patient or the person participating gets the vaccine. And then lastly, efficacy. So I'm hopeful that we'll continue to see these great results that we've seen in the older age groups regarding the safety, regarding the immunogenicity and the antibody levels that are appropriate, and then of course efficacy in preventing disease, specifically anything requiring hospitalization and of course death. And we'll probably see more and more information as time comes.
All right, Dr. DARIEN Sutton, always great to have you. Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.